this video, we'll be talking about implementation. What does implementation station and for NMC OSCE test of competence, what does it entail? It is not something that is difficult. It is as simple as you can ever think of. In this video, we'll be talking extensively in a simplified way how you can ace your implementation station for NMC OSCE test of competence. Let's dive directly into that. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7-step of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left dorsum, vice versa. Fingers interlaced, fingers interlocked. Rotation rubbing of the thumb, vice versa. Rotation rubbing of the finger close to my palm, vice versa. Rotation rubbing of my wrist, vice versa. My hands are clean. I allow my hands to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be attending to you today. How are you? All right, the reason why I'm here is to administer your due medication for 1200 hours. Is it a convenient time, please? All right, thank you very much. Before we continue, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, I am your Janet James. Okay, Janet James, right? Your date of birth is 1st of the 1st, 1992, 1st of the 1st, 1992. Okay, are you allergic to anything at all? All right, you're not allergic to anything. Okay, it's properly documented here that you are not allergic to anything. Okay, so how may I address you, please? Okay, Janet is fine. All right, Janet. Okay, like I said, the reason why I'm here is to administer your due 1200 hour medication. Okay, so is it okay to take you through the medication record chart? Okay, fantastic. I have the medication record chart for Janet James. The date of birth is 1st of the 1st, 1992. The address is 27 Dotting Grove, Badley Green. The height is 1.57. The weight is 70 kilogram. The body mass index is 23. The ward is Badley Green unit. The consultant is Dr. Tolu. The date of admission is today. The time of admission is 10:00 hour. The name of page for the prescriber. The name of the prescriber is Dr. P. Wright. The GMC number is 3214213. The signature is properly appended, and the blip number is 642. Okay, on the page where the details of the person administering medication is, after my patient might have taken the medication, I'm going to come back to properly document this area. I move on to the under alert and allergy. Janet is not allergic to anything. Therefore, the box there is no known allergy is ticked for Janet. I move forward to medication risk factor. There is no medication risk factor ticked for Janet. I move to the next page. I have still the match chart for Janet James. The date of birth is 1st of the 1st, 1992. The rest of the information on this page is as the same as the previous. Under this, I've read and understood the medication code. If need be, I'm going to come back to use accordingly. Under once, I move on to once only medicine. There is no once only medication prescribed for Janet. I move on to the next page. I have still the MAR chart for Janet James. The date of birth is 1st of the 1st, 1992. The rest details on this page is as the same as the previous. There is no prescribed oxygen for Janet. I move on to the next page. I have still the medication chart for Janet James. The date of birth is 1st of the 1st, 1992. The rest of the information on this page is as the same as the previous. Under antimicrobial, The first drug is flucloxacillin. The date is today. The dose is 500 milligram. The frequency is QD, that is 4 times daily. The route is per oral. The duration is 7 days. The time it was administered previously at 600 hour by a colleague, and the pharmacy check CG Thomas is properly documented. The start date is today. The finish date is plus 6 days. Caution was sent. The prescriber signature and blip was properly documented. It is a valid prescription, and it is due at my time, which is 1200 hour. I'm happy to administer this medication. All right, Janet, flucloxacillin, it's an antibiotic that is used for to prevent wound infection. And some of the side effects you may or may not manifest include and not limited to nausea, vomiting, and dizziness. Are you still happy for me to administer this medication? All right, thank you very much. Okay, so I move on to the next drug. Under antimicrobial, no other medication is prescribed for Janet. I move on to the next page. I still have the medication chart for Janet James. The date of birth is 1st of the 1st, 1992. The rest information on this page is as the same as the previous. Under regular medicine, I have the first drug to be Ramipril, and the date is today. The dose is 5 milligram. The frequency is once daily. The route is per oral. The duration is 7 days. It was previously administered by a colleague at 800 hour. It is a valid and legible prescription. The start date is today. The finish date is plus 6 days. And the prescriber signature and blip number is properly documented. It is a valid and legible prescription. It is not due in my time. I move on to the next medication still under regular medicine. I have docosate sodium. The date is today. The dose is 100 milligram. The frequency is twice daily. The route is per oral. The duration is 7 days. It was the start date is today. The finish date is plus 6 days. The prescriber signature and blip number is properly documented. It is a valid and legible prescription. Was previously administered by a colleague at 600 hour and is due at my time. So docosate sodium, Janet, is for constipation, is to relieve you of your constipation. All right, and some of the side effects which you may or may not manifest include diarrhea, abdominal disturbance, headache, or dizziness. Are you still happy for me to continue, please?